iPrevent listeners. Did you know that there is a day to raise awareness of the impact HIV and AIDS has on women and girls throughout the world? National Women and Girls HIV/AIDS Awareness Day is celebrated on March 10th, and us at iPrevent want to make sure we raise awareness not only today but every day.
National Women and Girls HIV/AIDS Awareness Day is an annual nationwide observance that focuses on the impact of HIV/AIDS has on women and girls. Every year on March 10th, federal, national, and community organizations come together and show support for women and girls impacted by HIV and AIDS.
HIV is a virus spread through certain body fluids such as blood, semen, breast milk, and vaginal fluids that attacks the body's immune system. HIV can destroy so many T cells that the body can't fight off infections and disease. T cells help the immune system fight off infections. There is no cure currently for HIV, but with proper medical care, HIV can be controlled.
AIDS is the most severe phase of the HIV infection. People living with AIDS immune systems are so damaged that they can get an increasing number of severe illnesses called opportunistic illnesses.
HIV and AIDS can affect anyone, but the risk of infection is significantly higher in patients suffering from substance use. The risk of getting or transmitting HIV is very high if an HIV negative person uses injection equipment that someone living with HIV has used. Needles may have blood in them, and blood can carry HIV. HIV can survive in a used needle for up to 42 days, depending on temperature and other factors.
Today, more than 1.1 million people are living with HIV in the U.S., and more than 270,000 are women. Black African American women are largely affected by HIV in comparison to women of another race and ethnicity. Most women contract HIV/AIDS from heterosexual sex. The Office of Public Health reports that New Orleans ranking among different age groups. Females in New Orleans rank 15th for anyone between the ages of 45 and 54.
From 2013 to 2015, the majority of new HIV diagnoses were among persons 15 to 35 years old in the New Orleans region.
HIV is the leading cause of death for women ages 15 to 44. Young girls in relationships are found to be at a greater risk for acquiring HIV because it is considered that their partner is more likely to have had previous sexual relationships.
Community factors of health like poverty, lack of education, and racism has been found to have a huge impact of HIV and AIDS on women and girls. Addressing these factors which affects health outcomes may advance efforts in reducing inconsistency in HIV diagnosis rates between populations. It can also provide insight for identifying populations or areas that may benefit from HIV testing, prevention, and treatment.
Interested in learning more about HIV or being linked to health services? There are many resources and clinics here in New Orleans, such as Odyssey House Community Medical Clinic located 1125 North Tonti Street. The iPrevent team focuses on providing information about HIV and Hep C. We also provide free HIV and Hep C testing to the community. Download our free app at iPrevent_OHL to see where we are in the community.